This is the surgical technique for the Atlas hip fracture nail. The first thing here is the implant case, which is modular and has 4 trays inside of it to allow different sizes of nails. It has slots for the nail caps as well as the lag screws. There is also a screw caddy to accommodate the compression screws and the cortical screws. This is the Atlas hip fracture nail screw caddy, and as you can see, there are slots for the compression screws, the distal locking screws for 4.5 mm for the smaller sized diameter nails, and the 5 mm locking screws for the other nails. And there are slots down in size for each one of these segments. This is the Atlas hip fracture nail implant case with all the modular trays and the screw caddy assembled within it. This is the Atlas hip fracture nail instrument case with the instruments slotted into their allocated areas on the tray, which are clearly labeled for easy assembly and removal. These are the Atlas hip fracture nails. They are titanium-based intramedullary nails that come in different sizes. These are the short nails, and these two are the long nails. This one is lime for left-sided nails, and this is rose for the right-sided nails. The hip fracture nails come in 3 different diameters: 9 mm, 10 mm, and 11 mm diameters. They allow the insertion of the integrated screws into the proximal part of the femoral head through the slots on each one at the top, as you can see, and subtending an angle of 127 degrees. The short Atlas hip fracture nail comes in a length of 17 centimeters, while the long nails have 12 degrees of inbuilt femoral anteversion. All the nails come with the 5-degree lateral offset, and the long nails have a 1.5 mm AP bow. The Atlas hip fracture nail comes with a circular proximal geometry, as shown here, and with a proximal diameter of 15.24 mm. Additionally, for the implants, this is the 4.5 mm distal screw that is used with the 9 mm Atlas hip fracture nail. This is the standard 5 mm screw that is used for distal locking with the rest of the nails. These are the nail caps that come in different sizes: 0 mm, 5 mm, and 10 mm. This is the integrated proximal locking mechanism with the lag screw on top and the compression screw below that. The compression screw is 5 mm shorter than the lag screw. The first part of the Atlas hip fracture nail surgical technique is identifying the entry point, which is critical for the technique. The patient would be on a traction table or a radiolucent traction table. The entry point is on the medial lip of the greater trochanter, here. The entry portal sleeve is used to push the soft tissues out of the way, and the 3.2 mm guide wire is inserted at the appropriate insertion point down through the proximal part of the femur. The cannulated entry awl can be used as an alternative. The black laser mark etching on the proximal reamer is the point at which to stop when that coincides with the top of the sleeve. For the purposes of this surgical technique, we will demonstrate the short Atlas hip fracture nail. However, for the long Atlas hip fracture nail, the fracture reducer, displayed here, can be used along with a bolt tip reaming wire to introduce the reamers and the nail. The reaming set is not part of the Atlas hip fracture nail instrument case and will need to be procured separately. The nail length gauge demonstrated here is used to measure the length of the long Atlas hip fracture nail that is required for the operation. The assembly components for the short Atlas hip fracture nail are shown here with the Atlas hip fracture nail drill guide, the locking bolt, and the guide bolt wrench along with the T-handle. For correct assembly of the short Atlas hip fracture nail, the black laser etchings on both the nail and drill guide should be aligned as shown here. As a further verification of the Atlas hip fracture nail assembly, we use the lag screw outer sleeve and the lag screw drill to ensure that it goes through the nail correctly. This will ensure that the assembly of the nail is in the right position. Once assembled, the atlas hip fracture nail is inserted into the proximal femur down to the appropriate length as dictated by the position of the proximal lag screw in the center of the femoral head on image intensifier X-rays. The long impactor can be attached to the hip fracture nail drill guide, and the slotted hammer can be used to impact the nail down to the correct position. The 3.2 mm guide wire can be used on the skin to determine anteversion of the atlas hip fracture nail and allow movement of the nail to the correct position. Once the atlas hip fracture nail is inserted, the lag screw outer sleeve is inserted into the drill guide and clicks into place. The guide pin sleeve is then inserted through the outer sleeve down to the bone. Using the slotted hammer, this is hammered in until the trocar tips of the guide pin sleeve are within the bone. Following that, the 3.2 mm guide pin is inserted to the desired place in the femoral head, allowing the tip apex distance to be less than 25 mm and having the position center-center in the femoral neck and head as confirmed on image intensifier AP and lateral views. The lag screw length gauge is used to measure the length of the lag screw. In this case, it measures 100 mm. If no compression is required, a 100 mm lag screw and its corresponding 95 mm compression screw should be used. Following measuring for the lag screw, the compression screw starter drill is used. This starter drill has a hard stop and is used to open the lateral cortex. After the starter drill is used, the compression screw drill is used. This has graduations on it and needs to be drilled to the appropriate length of 95 mm. Following that, the anti-rotation bar is inserted. This provides rotational stability in the femoral head as an important step. After the anti-rotation bar is inserted, the guide pin sleeve is removed. And the lag screw drill is inserted and drilled to the desired length, in this case 100 mm. And this measurement can be seen on the actual drill. In case of hard femoral bone, the lag screw tap can be used as demonstrated here. The atlas hip fracture nail lag screw is assembled using the lag screw driver and retaining rod. You will note that there is a groove on the lower part of the driver corresponding to that of the lag screw. This is now inserted over the wire to the desired length of 100 mm. Insertion is stopped at the 0 mm laser mark etching. Following that, the anti-rotation bar is removed. The lag screw driver's final position should be perpendicular to the drill guide to accommodate the compression screw inferior to the lag screw. Next step is the insertion of the compression screw to the desired length. Insertion should stop when the black laser mark etching is at the outer sleeve. The key for retaining rod is then used to remove the retaining rod from the compression screw. The T handle is removed and the compression screwdriver is removed. The key for retaining rod is then used to remove the retaining rod from the lag screw. And the lag screw assembly is removed. This completes the insertion of the lag screw and compression screw when no compression is required. If active linear compression is required with a 5 mm fracture gap, as demonstrated here, and if, as previously explained, the length of the lag screw is measured at 100 mm, then 5 mm will need to be subtracted from that for the lag screw actual length, which will be 95 mm in this case, and its associated compression screw of 90 mm. The lag screw is inserted as previously described. However, it is inserted to the laser marking of 5 mm as shown here to allow for 5 mm compression. Following insertion of the lag screw as previously described, the compression screw is inserted. At this stage, when the black laser marking on the compression screw is flush with the outer sleeve, you will start to note active linear compression occurring at the fracture site. Active linear compression is stopped when the zero marking appears on the outer sleeve on the lag screw drill. Full active linear compression of the fracture gap is achieved using the Atlas hip fracture nail integrated screw mechanism. Following insertion of the lag screw and compression screw, the outer sleeve is removed and the distal sleeve guide block is inserted. The 9 mm distal drill sleeve is inserted and the 4 mm pilot drill is used for the distal locking screw. This is graduated and measurements can be read off the graduated part on the drill. Alternatively, the screw length gauge can be used to measure the length of the screw. The appropriate length distal cortical screw is assembled on the hex driver and retaining rod and is inserted. The distal cortical screw is in position and the guide block can be removed. For distal locking of the long Atlas hip fracture nail, a freehand technique is required using image intensifier and the use of a standard 4 mm drill and standard depth gauge. The Atlas hip fracture nail drill guide is removed using the guide bolt wrench to remove the locking bolt. The nail cap set screw is assembled onto the hex driver and fixed with the retaining rod. This is insertion of the 5 mm nail cap set screw. This completes the insertion of the short Atlas hip fracture nail with maintained active linear compression using the integrated lag screw and compression screw, distal locking with the cortical screw and the nail cap set screw in place. For removal of the Atlas hip fracture nail, start by removing the set screw using the hex driver and the retaining rod. Similarly, the same hex screwdriver and retaining rod is used to remove the distal locking screw. Following that, the compression screw is removed using the compression screwdriver. And the lag screw is removed using the lag screwdriver. After all the screws and the set screw have been removed, the extractor is inserted into the top part of the hip fracture nail. This threads in. The long impactor is threaded into the top part of the extractor. And the slotted hammer is used to extract the nail. This completes the Atlas hip fracture nail surgical technique.